Hi everyone, my name is Dr. Jessica Jennings. I'm here with three-dimensional physical therapy. I'm going to demonstrate a dry needling technique for the lower limb, for either the calf muscle, the Achilles, and I'll talk about some other muscles that we might get. This is really good for anyone with calf pain, Achilles pain, plantar fasciitis, lots of lower limb injuries. So we're going to demonstrate getting into his gastroc muscle first. Using a 40 millimeter needle. Depending on the person's calf size, you may need to use larger. We're not necessarily expecting to hit bone, just depending on the person's calf size. We can also palpate along the muscle belly to find out if there are any trigger points and try to target that area. Doing all right, Brian?
I'm doing good.
All right, awesome. So next we're going to try to go towards the junction between the gastroc and the soleus. This is an area that a lot of people get a lot of tension in. A lot of runners get a lot of adhesions in this area. And then we're also going to go for his Achilles. Now, Brian has had Achilles issues on this side, so it'll be interesting to see how his tissue is. So we can go right into the bulk of the tendon. We're probably not going to go as far with this size needle. It is pretty sticky, it doesn't want to go in. We'll just leave that one there. We'll try another one. So he's got some pretty thick tissue in his Achilles. So it's a good thing we're treating him. Now from here we can also do the peroneal muscles, which are the muscles on the outside. Those are really good to target if someone has had an ankle sprain, because those muscles usually get strained when you roll your ankle. And there we do expect to hit some bone. You can also target the tibialis posterior on this side, plantar fascia down here. And I would like to note that in addition to these needles, we would probably place some needles up in his lumbar spine that correlate with the innervations of these muscles. We could also apply stim to that to further increase the parasympathetic response. We would leave the needles in for about 20 to 30 minutes so that he has the full effect. But this is a really great way to treat any sort of lower limb pathology.